Do you know migraine is not the commonest headache in adults, yet it is one of the most commonly misunderstood headaches out there? Yes, let's dive down to the world of headaches today. A typical migraine attack involves four phases: the prodrome, the aura, the headache, and the postdrome. The exact progression and symptoms differ from person to person. The prodrome. Many people start having symptoms 24 to 48 hours before a migraine headache comes on. These may include increased yawning, a feeling of euphoria, depression, irritability, food cravings, constipation, or neck stiffness. Next, the aura. About 25% of people with migraines experience an aura before the headache. Aura symptoms may include flashing lights or bright spots, zigzag lines, changes in vision, or numbness and tinglings in the fingers and hand, lips, tongue, or lower face. You may have one or more of these aura symptoms. Aura may also involve other senses and can occasionally cause temporary muscle weakness or changes in speech, and these symptoms can be frightening. Aura symptoms typically last about 5 to 20 minutes and rarely last more than 60 minutes. The headache typically occurs soon after the aura stops, although some people with migraine do experience aura without a headache. The headache. The pain of a migraine headache usually begins gradually. It intensifies over 1 to several hours and resolves gradually at the end of the attack. It frequently affects only one side of the head. The headache is typically dull and steady when mild to moderate in severity, and becomes throbbing or pulsatile when more severe. And finally, the postdrome. Once the spontaneous throbbing of the headache resolves, the patient may experience a postdromal phase, during which sudden head movement transiently causes pain in the location of the headache. During the postdrome, patients will often feel drained or exhausted. What can aggravate migraine headache? Migraine headaches may be aggravated by light, sneezing, straining, constant motion, moving the head rapidly, or physical activities. Many people try to get relief by lying down in a darkened, quiet room. In adults, migraine headache usually lasts a few hours, although it can last as long as up to 72 hours in certain cases. Migraine headaches are often accompanied by nausea and vomiting, as well as sensitivity to light and noise. Some people also feel very sensitive to touch and may find normal activities such as brushing, shaving, or putting in contact lenses painful. Triggering factors. Migraine can be triggered by many different things, including stress, physical exertion, fatigue, lack of sleep, hunger, chemicals, and certain medications. Here is a table of all the possible triggering factors. You may pause the video if you like to. In females, migraines can be triggered by the normal decrease in estrogen levels that occurs before the menstrual period each month. It is recommended for people who have frequent or severe headaches to keep a headache diary over the course of 1 month. In the diary, you can keep track of your headaches and record information about how long it lasts, the location and severity of the pain, what you did and ate before it came, and whether it responded to the treatment. This can be used to determine what triggers the migraines and what makes them better. The treatment. The pain of migraines can be tough to get rid of. Treatment is most likely to work if you take it at the first sign of an attack. Some people consistently experience an aura before the migraine, and therefore, aura can serve as a reliable warning that a migraine headache is on the way and should be a signal to take migraine medication immediately. If you do not get an aura, it's best to take the medication as soon as possible once the migraine headache begins. Common pain relievers used to treat migraines which are available over the counter includes aspirin, acetaminophen, also known as Tylenol, or non-steroidal anti-inflammatory drugs such as ibuprofen. If pain reliever does not work, your doctor may recommend a treatment that is migraine specific, which includes a class of medications we call triptans. A common example will be sumatriptan. It is available in oral form, nasal spray, as well as injectables. Nasal spray works faster than the pill form and has fewer side effects than the injection. The most common side effects of nasal spray is unpleasant taste. Do note, however, certain people with health conditions should not take triptans, and this includes pregnant lady, uncontrolled high blood pressure, or a history of heart problems or stroke. So there you have it, guys. This is how doctors treat migraines. Stay tuned because I'll tell you how to prevent migraine in the next episode. Don't forget to share, like, and subscribe. See ya!